Darou, the founder of Darou Wellness, and today we are going to be talking about women, hormones, and hormonal acne. Before we get started, Shawna, thank you so much for being with me today.
Thank you. Thanks for having me.
Tell me a little bit about yourself, what you do here, and about Darou Wellness.
So I'm a naturopathic doctor and I have specialized and focused on women's hormones for about 12 years now. So this is the main area of my naturopathic practice. In the past 3 months, I've expanded my practice to Darou Wellness, which is now an integrative health clinic. So still focusing on women's health, we've branched out a little bit more into complete family care as well. My vision with this clinic are a few things. One of them is to create an integrated team so that we can work together with our patient care, and also to provide a space where we can do more education and building community. So in this clinic we also have a studio space where we do lectures and talks and workshops and community building, because I feel like that's a really essential part of health, especially for downtown women.
So now talking about hormones, I want to really get specific about how hormonal health directly affects our skin. So first of all, how does a woman know if she has a hormonal imbalance? What are some telltale signs?
Okay, well, in some cases they can be really extreme, like they can be a lack of a period or periods coming once or twice a year. But sometimes they're more subtle. It might be persistent acne that won't go away. It could be extra hair growth, so especially on the face, so upper lip, under chin, jawline, sometimes extra body hair. It can be unusual weight gain patterns, so carrying a lot of weight around the abdomen is a sign of a hormone imbalance, difficulty losing weight or difficulty gaining weight, hair thinning on the head, really bad PMS, mood swings, a little bit of, PMS mood changes normal, but if it's interfering with life, I would call that a hormone imbalance as well.
How would they know if it was hormonally related acne?
Well, that's something I'm really big on, is actually testing.
Okay.
So I find that people will go to a dermatologist, they'll be told that they have hormonal acne, to go on the birth control pill, but nobody's actually tested their hormones. So that would be the very first thing I would do, would be to do some really basic blood work to look at testosterone levels, and as well as some other hormonal androgens, so hormones like DHEA, androstenedione. That in combination of looking at their menstrual health history and other things, we can very accurately know, is it hormonal acne or not. So hormones will amplify acne no matter what the cause is, and that's where it gets confusing. So even if the acne primarily isn't hormonal, the birth control pill might help just because it's blocking the testosterone expression on the skin. And that creates an environment that is friendly for acne, but not necessarily the cause.
Right.
So that's again the reason for testing the hormones first, is that it might be all food related, it might be diet, it might be stress. There's so many other potential causes of acne.
Good to know. I was hoping we could talk a little bit about lifestyle factors that can affect hormones, imbalances, and acne. So first of all, food and drink. Are there things that we're eating and drinking that are making our skin and our hormones worse?
Definitely. So the first thing that I'm looking at if I have a patient with acne, especially if it's not clearly hormonal, is food intolerances.
Okay.
So if a woman has a food intolerance, which is different than an allergy, a food will be causing inflammation, and for a lot of us that shows up on our skin, ranging from acne to eczema to psoriasis to rashes. The most common thing that we all know about is dairy. And not for everybody, but dairy products are often big acne triggers. Other things I'm looking at are sugar intake and balance in blood sugar levels. And then there's the real basics, like foods that are hard to digest and hard on the liver, like too much fried food, fast food, too much caffeine, too much chocolate, which I think are all fine in small moderation, but in large amounts will definitely show up on the skin.
Next lifestyle factor, exercise. Does exercise help to balance out our hormones and potentially clear up our skin?
So exercise can help tremendously, but it can also aggravate it. It depends what's going on.
Interesting.
So yes, if a woman has a lot of stress in her life and then goes into a really high intensity workout, which most of us will want to do when we're in that stress state, what it can do is it can increase a hormonal an adrenal androgen called DHEA, which causes more testosterone and more breakouts. So we have to be careful depending on what's going on in life. In general, exercise definitely a big plus for skin, but keep it moderate, don't overdo.
Last but not least, in terms of the lifestyle factors, stress. How does stress and stress hormones directly affect our hormone imbalance and our skin?
Stress will, again, amplify whatever else is going on. So dealing with stress is one of the most important things to fix a hormone imbalance. An increase in stress hormones can affect your estrogen, your progesterone, your testosterone, your period regularity, your fertility, and all of these things.
Everything.
Yes, and
Everything.
for some people more than others.
Yeah.
Yeah.
Do you believe that hormonal acne can be cleared up topically? So using skincare products?
So the products may reduce a little bit of the flare-up, so they're going to dry out the skin and they'll dry out the pimples and they will become a little less noticeable, but they're never getting to the root of it.
Yeah.
And the root of it is always internal.
And what are your thoughts on face mapping? For those of you who have never seen it before, it just divides the face into certain sections. And if you break out in certain sections, for example, along the jawline or on the forehead, that signifies different imbalances in different parts of the body. What are your thoughts on that?
Sometimes it's pretty true.
Really?
Yeah.
Okay.
So, like true hormonal acne related to high androgens, high testosterone is very often like lower jawline, under the neck area, and big cystic pimples. So that would be a pretty good indicator of hormonal acne. Stress breakouts are almost always on the chin. Lots of little bumps on the forehead I find is a pretty good indicator of food intolerance. Not always, but a pretty good one.
Okay.
And breakouts around the nose are gut digestive issues. It's usually smaller bumps, more irritated, sort of a cross between acne and eczema type of thing, and that's almost always an irritated digestive tract.
Fascinating.
Yeah.
What are your top 5 takeaway tips that anyone watching today can really take from this and adapt into their own daily life and practice to deal with hormone balance and acne?
Number one, I would say if you're suspecting that you have hormonal acne is to get tested. So seeing a doctor or a naturopath and testing first your hormones. If that's negative, then testing for food intolerance. The second would be a dairy-free trial. So dairy affects the skin so often, but starting with a month, if there's some indicator that that tells you yes, this is helping, you would keep it up. Number 3 would be to balance blood sugar levels, and what that means is a lot less sugar in the diet, minimizing anything made with white flour, minimizing white rice, simple carbohydrates, because having an imbalance in blood sugar levels is a really common cause of skin breakouts. Or it would be to increase nutrition overall, so especially emphasizing the veggies and the dark leafy greens and lemon water in the morning, minimizing fast food, fried food, desserts and treats and ice creams and that type of thing. Again, 80-20, I'm all for it.
Yeah.
But working on increasing the nutrition, you'll support your liver and your skin will show it for sure.
Yeah.
And the last one is to manage stress. So as we talked about before, because stress is such a big factor in making the skin problem bigger than it normally would.
Wonderful. Thank you so much, Dr. Darou, for taking the time today, and thank you guys so much for watching. If you like this video, don't forget to give it a thumbs up and subscribe to my Clean Living YouTube channel. And for more clean living amazingness, head to taliachai.com and sign up for updates. Thank you guys so much for watching, and I'll see you next time.